Try something with me right now. Just swallow once and pay attention to what you feel at the very back of your throat. Is there something there? A thickness, a heaviness, a coating that simply refuses to leave no matter how many times you clear your throat? And if I asked you how long that feeling has been there, you might pause because honestly, you are not even sure anymore. It did not arrive all at once. It started small, maybe just in the mornings, just for a few minutes after waking up. Then it stretched into the afternoons. And somewhere along the way, without you ever making a conscious decision about it, clearing your throat became something you do automatically dozens of times every single day, like breathing. You have probably tried things. You carry water with you wherever you go. You have cut back on certain foods. You have sipped warm drinks and tried whatever a neighbor or a relative swore worked for them. And still, the feeling is there. Every morning, every afternoon, sitting at the back of your throat like an uninvited guest who simply will not leave. Here is what I need you to understand before we go any further. That feeling is not random. That persistent coating is not simply the result of getting older and having to accept things. Your body is not doing this without reason. Every symptom that continues day after day is your body sending a signal. And the most important thing I can do for you today is help you decode that signal. Because in my years working in preventive health and senior wellness, I have seen this specific issue, chronic throat mucus in adults over the age of 55, misunderstood more often than almost any other complaint I encounter. People are handed cough drops. They're told to drink more water and come back if it gets worse. And the actual underlying drivers of the problem, the specific physiological causes sitting quietly beneath the surface, are never explained. That ends today. We are going to walk through 5 distinct, research-supported causes of persistent throat mucus in older adults. And I'm going to do something that most conversations on this topic skip entirely. I'm going to tell you which 2 of these causes almost always occur together, and why that specific combination makes everything dramatically harder to manage. My name is Dr. Wilson. I specialize in preventive health and wellness for older adults, and my promise to this community is always the same. Real science, plain language, practical steps you can begin using today. Before we go any further, I want to hear from you. Leave a comment right now and tell me this. Is your throat mucus worst first thing in the morning, or does it stay with you throughout the entire day? Just type morning or all day. Your answer actually tells me quite a bit about what is most likely driving this in your body. I read every single comment. Now, let us start with the piece of biology that most people have genuinely never been told, because it changes the entire way you will understand everything that follows. Your body produces mucus every single day, every hour, around the clock, and that is not a problem. That is completely healthy and completely necessary. Mucus is your body's internal protective coating for your airways. It traps bacteria. It catches dust and airborne particles before they can travel deeper into your lungs, and it keeps the delicate tissue lining your throat and airways moist and resilient. The problem is not mucus itself. The problem is what happens to that mucus over time as we age. Your airways are lined with millions of microscopic structures called cilia, tiny hair-like fibers whose only job is to sweep mucus upward and outward in a constant, coordinated motion. In a younger body, this system works quickly and efficiently. Mucus is produced and cleared almost before it has a chance to accumulate. But research has confirmed something important. As we get older, these cilia slow down. They beat less frequently. And the mucus that might have been cleared in a matter of seconds at age 38 can pool and sit at the back of your throat for hours at age 64 or 70. This is not a complaint about aging. It is simply physiology. And understanding is the foundation of everything else we are about to discuss. With that as our starting point, let's talk about the first cause. And I want you to give this one particular attention, because clinical research consistently identifies it as the most frequently overlooked explanation for persistent throat mucus in this age group. It is called Laryngopharyngeal Reflux. You may not have heard that term before, so let me break it down in plain language. Most people know what heartburn feels like. That burning sensation in the chest after a heavy meal, the familiar discomfort of classic acid reflux. But there is a quieter, far more deceptive version of this same problem, one that produces no chest burning whatsoever, no obvious digestive symptoms, no dramatic clues pointing toward your stomach, just a throat that will not settle. Here is what is happening. Where your food pipe meets your stomach, there's a muscular ring that acts as a valve. Its entire purpose is to stay firmly closed after you eat, keeping stomach acid exactly where it belongs. As we age, that valve can gradually lose its tone, the way a rubber band weakens after years of use. When it does not close completely, stomach acid can travel upward, and in some people, it travels all the way past the esophagus and reaches the throat, the voice box, and sometimes even the nasal passages. Now, here's what makes this particularly significant. Your throat tissue is not built to tolerate acid the way your esophagus is. Even the faintest trace of acid reaching your throat triggers an immediate protective response. Your body floods that irritated area with thick mucus to coat and shield it. This is logical, sensible biology. But when this is happening night after night while you sleep, lying flat, gravity working against you, you wake up every single morning to that familiar heaviness at the back of your throat with absolutely no idea why, because there is no heartburn to connect it to. Research published in clinical ear, nose, and throat literature shows that up to half of people dealing with this condition report zero heartburn. Their only symptoms are chronic throat clearing, a rough or different sounding voice in the mornings, and mucus that begins accumulating the moment they open their eyes. Ask yourself honestly, is your throat noticeably worse when you first wake up compared to later in the day? Does it worsen when you bend forward or lie down after eating? Has your voice sounded different or rougher in the mornings? These are the quiet fingerprints of silent reflux, and I will give you specific practical steps to begin addressing it in just a few minutes. One thing worth noting here, if you regularly take anti-inflammatory medications for joint pain or arthritis, ibuprofen or naproxen being the most common examples, research has established clearly that this class of medications reduces your stomach's natural protective lining. That makes silent reflux significantly more likely to develop or worsen. If that describes you, please bring that specific connection up with your doctor. The second cause tends to arrive so quietly that people simply do not notice it building. When most people picture sinus problems, they imagine the dramatic version. Crushing pressure across the forehead, throbbing behind the eyes, a nose so blocked that breathing becomes a conscious effort. But in many adults over 55, chronic sinus inflammation presents in an almost invisible way. Breathing feels mostly normal. There is no dramatic headache, and yet the sinuses, mildly swollen and producing slightly more mucus than they should, are steadily draining that mucus down the back of the throat all day long. Quietly, constantly. A 2024 study confirmed that the average age of patients presenting with this pattern is precisely 55, and that is not a coincidence. What makes this frustrating is that many people dealing with this have been using over-the-counter antihistamines for months, assuming the problem must be seasonal allergies. And there is a reason that approach tends to disappoint. Antihistamines temporarily dry the mucus, but they do nothing for the underlying inflammation inside the sinuses that is driving excess production in the first place. And dried, thickened mucus sitting at the back of your throat is often more uncomfortable than what you started with. The approach with the most consistent research support is remarkably simple and requires no prescription. Regular nasal rinsing using a warm saline solution. A clinical review published in 2025 in the journal Medicina, surveying evidence across a wide range of sinus and nasal conditions, concluded that nasal irrigation is a safe, effective, and low-cost strategy for managing and preventing upper respiratory tract issues, and is widely recommended by ear, nose, and throat specialists around the world. High-volume saline rinses work by physically flushing out inflammatory mucus, reducing swelling in the nasal lining, and supporting the natural ciliary clearance function we discussed earlier, the very same function that declines with age. The single most important factor with nasal rinsing is not technique. It is consistency. 1 or 2 uses gives you 1 or 2 days of mild relief. Daily practice, maintained correctly over 2 or more weeks, produces real, cumulative, meaningful improvement. The third cause is where I see the most genuine surprise. Because when people come in and we begin working through what might be responsible for their persistent throat symptoms, their medications are simply not something they think to question. They've been taking those pills faithfully for months or years, and connecting them to a throat problem feels like a stretch. But there is a specific class of blood pressure medications called ACE inhibitors, angiotensin-converting enzyme inhibitors, that carry a well-documented class-wide side effect. They allow a substance called bradykinin to accumulate in the body. And in a meaningful proportion of people, between 5 and 20% of users, according to available research, that accumulation triggers persistent throat irritation and a relentless urge to clear the throat. This is not an allergic reaction. It is not something unusual happening in your body. It is simply how the medication works, and your throat is sensitive to that particular effect. Here is what causes this connection to be missed so often. The side effect can take weeks, sometimes months, to develop after first starting the medication. So if you began a blood pressure pill 8 months ago and your throat started bothering you 5 or 6 months ago, those two events may never have been mentally connected. But that timeline is precisely what the research describes. A large-scale study involving more than 27,000 patients found that adults over the age of 65 had a 53% higher likelihood of experiencing this specific throat side effect compared to younger users. That makes this a particularly important consideration for this audience. If you take a blood pressure medication and are unsure whether it belongs to this class, your pharmacist can confirm it for you in under a minute. And if it does, there are alternative medication categories called ARBs, angiotensin receptor blockers, that manage blood pressure equally well without this specific side effect. That conversation with your prescribing doctor is genuinely worth initiating. The fourth cause surprises people not because it is complex, but because it seems too simple to matter. Hydration. But let me give you the actual physiology, because this goes deeper than a simple reminder to drink more water. Your mucus is composed primarily of water. Its consistency, whether it is thin and fluid and easy to move, or thick, sticky, and difficult to clear, is directly tied to how well hydrated the surrounding tissue is. Imagine maple syrup poured fresh from a bottle compared to maple syrup that has been sitting open overnight. Same substance, completely different behavior. Your mucus responds in exactly the same way based on your body's hydration state. Here is the specific aging-related detail that makes this more than just general wellness advice. Research has confirmed that the body's thirst mechanism becomes measurably less reliable as we age. A younger person feels the pull of thirst well before they become meaningfully dehydrated. In older adults, that early warning signal is blunted. You can be dehydrated enough that your mucus consistency is noticeably affected without feeling particularly thirsty at all. Waiting for thirst to prompt you means you are consistently operating behind the curve, and a mildly dehydrated state maintained across days and weeks keeps your mucus persistently thick and sticky in ways that amplify every other cause we have discussed. A practical fluid target referenced broadly in clinical nutrition guidance is approximately 30 milliliters per kilogram of body weight per day, drawn from all sources. Water, herbal teas, soups, and water-rich foods all count. But the behavioral key is intentional, consistent intake spread throughout the day rather than trying to catch up when thirst finally arrives. The fifth cause is the one that is discussed least often in conversations about throat mucus, and I believe that represents a genuine gap. Because for a meaningful number of older adults dealing with this problem, the origin point is not in the throat, not in the sinuses, and not in the stomach. It is in the gut. Research shows that your digestive tract and your respiratory system share regulatory pathways through both the immune system and the nervous system. The bacterial ecosystem living in your intestines, your gut microbiome, directly influences how reactive and how inflamed your upper airways are. When that bacterial balance is disrupted, a state researchers call dysbiosis, it can activate immune responses that drive mucus overproduction in the airways, not because anything is physically wrong in your throat, but because the gut is sending inflammatory signals that your respiratory system is responding to. This connection, sometimes called the gut-lung axis, is an active and growing area of clinical investigation. Research published in journals, including the American Journal of Respiratory and Critical Care Medicine, has confirmed that microbiome disruption can promote airway inflammation. Animal studies have gone further. When gut microbiome material from patients with chronic lung disease was transferred to healthy mice, those animals showed measurably increased airway mucus production, pointing toward a direct causal link between gut health and what happens in your airways. What disrupts the gut microbiome in older adults? A diet low in fiber, repeated antibiotic courses accumulated over the years, high sugar intake, chronic stress. These are not exotic factors. They describe the daily reality of a very large proportion of people in this age group. A throat lozenge will not reach the gut, but consistent daily dietary choices can begin to shift that balance over time. Now for the part where everything we have covered becomes something you can actually act on. Tonight, stop eating at least 3 full hours before lying down. When you eat and immediately recline, your stomach is still actively processing and the valve we discussed earlier is working hardest to stay closed. 3 hours of upright time after your last meal is one of the most well-supported behavioral changes for reducing nighttime silent reflux. Elevate the head of your bed using a firm wedge placed under the mattress or under the legs of the headboard, not simply by stacking extra pillows under your neck. Even a modest incline uses gravity as your ally and meaningfully reduces overnight acid travel toward the throat. Before bed, drink a full glass of warm water to support overnight hydration and help keep mucus thinner through the night. Tomorrow morning, before coffee and before breakfast, drink 1 to 2 glasses of plain warm water. This single habit costs nothing, begins rehydrating your body immediately, and starts loosening any mucus that has accumulated overnight before it has the chance to define your whole morning. This week, pick up a nasal rinsing device from your local pharmacy, either a neti pot or a squeeze-style bottle. Use water that has been boiled and allowed to cool to a comfortable warm temperature rather than tap water directly. Add a small pinch of plain salt and optionally a very small pinch of baking soda, which can help thin mucus gently by moderating nasal acidity. Use it once each morning. Commit to 2 full weeks of consistent daily use before forming any opinion about whether it is helping. Consistency is the entire difference between the people who say it works and the people who say it did not. Schedule an appointment to review your medication list in the specific context of your throat symptoms. Write down the timeline before you go. When did the throat symptoms begin? When did you last start or change any medication? Bring that written chronology with you. If you take a blood pressure medication, ask directly whether it falls into the ACE inhibitor category and whether an ARB alternative might be appropriate given your symptoms. To begin supporting the gut-airway connection, add 1 small daily serving of a fermented food to your routine. Plain yogurt with live active cultures, kefir, a small portion of kimchi or sauerkraut. These choices begin diversifying and supporting the gut microbiome in ways that research links to reduced airway inflammation over time. This is a long-game strategy, not an overnight solution. But the long-game strategies are the ones that actually shift your baseline in a lasting way. Set intentional hydration reminders throughout the day. Keep water accessible in every room where you spend significant time. Incorporate more water-rich whole foods into your meals. Cucumbers, melon, warm soups, herbal teas. The difference in your mucus consistency is something many people begin noticing within just a few days. And a brief, honest note about some of the popular home remedies you may have already tried. Honey genuinely soothes irritated throat tissue. It is not harmful and can bring temporary comfort, but it does not address any of the 5 root causes we covered today. The widespread belief that dairy creates mucus is not well supported by the science, though some individuals notice a sensation of increased thickness in existing mucus after consuming dairy proteins. If you notice a consistent personal pattern, a 2 to 3 week reduction trial is a reasonable experiment. Apple cider vinegar is frequently suggested online, But for anyone dealing with silent reflux, introducing additional acid into the system can genuinely make the problem worse. Please approach that one carefully. Here is what I want to stay with you. The mucus coating the back of your throat has a reason. 5 possible reasons. In fact, and most people living with this have never had a single one properly explained to them. Silent reflux, occurring overnight with no heartburn to signal it. Chronic low-level sinus inflammation, draining quietly and persistently without dramatic symptoms. Medication-related throat irritation from ACE inhibitors developing months after starting a prescription and never getting connected to it. Mild chronic dehydration operating just below the threshold where obvious thirst kicks in. And gut microbiome disruption sending inflammatory signals that the respiratory system is actively responding to. None of these require you to simply accept throat clearing as a permanent feature of life. Each one has a practical, evidence-grounded response. None of the first steps require a specialist or a prescription. They require knowledge, consistency, and a willingness to treat your symptoms as a signal worth responding to rather than a nuisance to manage. If someone has ever told you that this is simply part of getting older, I hope today gave you a different and more accurate lens. You're not simply aging. You're dealing with specific, identifiable, addressable physiology, and you deserve to understand it fully.